I am Dr. Sridhar Kalyanasundaram, consultant neonatologist and pediatrician. In this video, we will discuss the concept of lactose intolerance. So basically, milk sugar is lactose. The cow's milk as well as the mother's breast milk has a form of sugar called lactose. And the enzyme lactase is an enzyme needed to digest the lactose in the tummy. Some of us have a low level of this enzyme. In the newborn period, as the body realizes that the main source of sugar is the lactose, there is a surge in the level of lactose in the lactase enzyme in the intestinal lining. So the baby mostly is able to digest the lactose sugar quite well. However, there are some circumstances, like in premature babies. In some babies, the proportion of lactase enzyme is low to start with. Then there is a little bit of lactose intolerance. So there is a debate about whether colic is related to lactose intolerance. It's not definitively proven. There are some cases who may benefit from a reduced lactose intake, but obviously in exclusive breastfeeding baby, that would mean reducing the breast milk and introducing another milk, which is absolutely not justified. So remember that lactose intolerance is not a common problem. Some degree of lactose indigestion may happen from time to time in babies, but that doesn't justify stopping breast milk or reducing the breastfeeding. One of the main features of lactose intolerance is acidic stools. So they tend to get persistent nappy rash which doesn't respond to the routine measures. Be aware that most of the nappy rash can be treated with simple measures like proper nappy care. You can refer to my video on skincare relating to that. Mainly don't use pressure to clean. The babies do pass stools frequently and it may abrade the skin, and then once the skin is lost, it may get infected. So secondary infection is a possibility. Do change the nappy on time. Don't allow it to be soaking for a long time. And use the nappy cream as a preventive, because the barrier in the nappy cream will prevent the skin getting broken down. So these are important measures to prevent nappy rash, and even if the rash happens and the lactose intolerance aggravates it, it can be treated with the traditional ways of handling the nappy rash, as I have discussed in the other video. So sometimes older children get a relative lactose intolerance. As we get older, the lactase enzyme reduces, and even as adults we may perceive bloating after we have cow's milk, and that may happen with older children as well. So if the child persistently complains of tummy pain or bloating after drinking milk, reduce the volume of milk you give. That's a simple measure which will help. You don't need to stop dairy products, reduce the quantity. Total lactose intolerance is very unusual. So partial intolerance can be managed by reducing the load, as I mentioned. If it is a persistent severe lactose intolerance, you get diarrhea, you get persisting nappy rash, and you may need to do further tests to confirm that, and a special milk may be needed. But these are very rare situations which we don't face normally. Most of the anticolic formula have a lower level of lactose, and these can help babies who are already on some formula milk if they have an element of lactose intolerance. We do have antidiarrheal or lactose-free milks which have a low or zero lactose level. These can be used for temporary measure, because after an episode of gastroenteritis, for example, in the later parts of infancy, the gut epithelial surface is shed off, and so the new cells that are produced have lower level of lactase enzyme. So the ability to digest the lactose sugar is reduced for a period of 1 to 2 weeks when this regeneration happens. During this period, the lactose-free milk might help. So this is just an overview of the problem of lactose intolerance, and I hope it helps. Do subscribe, keep notifications on, and do share this video. Thank you.